Hi, I'm here to talk to you today about something a lot of people suffer, especially in the fall when all their leagues pick up. It's called tennis elbow or lateral epicondylitis. There's a couple ways you can get it, but one of the primary ways is racket sports, which involves swinging. Any other repetitive activity where you're gripping something while you're doing it, such as, a construction worker swinging a hammer. But basically it involves the extensor muscles of the wrist, and they attach up at the lateral condyle of the elbow. And so any activity where you have to grip, picking up a coffee cup, grabbing something, that's when you typically feel the pain, and it can be quite painful in its early stages. The most important thing to do when in the early stages is to use the RICE method, which is resting, avoiding the activities that make it worse. You want to make sure you apply ice, compression, and elevate. The other thing you can do when referring to tennis specifically is making sure that the racket you're using is the proper weight. Sometimes using a heavy racket can make these symptoms worse. So here at Monmouth Pain, we treat all kinds of injuries, but especially tennis elbow, and we use a well-rounded approach such as acupuncture, physical therapy, chiropractic care to treat injuries such as this. So basically, once the pain is subsided, one of the first things you can start to work on is stretching these muscles. And what you want to do is hold your arm straight out in front, grab the palm of your hand and gently pull down on the wrist until you feel a stretching up in the forearm. You want to hold each stretch for about 30 seconds and do anywhere from 3 to 5 of them several times a day. And once you've are able to do the stretching without much difficulty, you can start to work on strengthening those muscles again. So what you would do is place your elbow on a table, and you can start with something as light as a racket or a water bottle, and basically you're working into that supination or turning the arm up and down. Okay, so you can do 15 reps of those 2 sets, and then progress to using something like a hammer or a dumbbell or something with a little more weight to progress that activity. Hopefully you're all out there and pain-free, but if you do find yourself with questions or pain, please give us a call at Monmouth Pain and Rehabilitation, and we're happy to help you out.